Good morning, everyone. I'm so happy you tuned in today. Welcome back to Wellness Wednesday. My name is Dr. Linzi, and I am a naturopathic doctor right here in Iron River. I specialize in helping people restore their life and revitalize their life as well. And always a disclaimer though, anything discussed is for the purpose of general health support, not intended to treat or cure disease or anything like that. We're just talking about overall physiology and optimizing health. Always check in with your primary care before making any changes. Last week, little recap, we talked about something that was really helpful with how I viewed health, success, weight loss, habits, and honestly, life itself. And it was about discipline and not what you would normally think about discipline. So you definitely want to check that out. You can head over. I have the recording on my YouTube channel, Dr.Linzi ND. You can also message me on Facebook. I'm happy to send you the replay if that's easier for you. Happy to share that with you guys. It's really good info and it's helpful for you to make the changes you need to be healthy in your life. And then today, I wanted to start with two questions that I asked on social media this week. One was, how many of you have taken birth control? And also, I know this is kind of more specific to females, but males forget that testosterone is actually the male version of birth control, but that's a topic for another day. So the question was, how many of you have ever taken birth control and how many of you have been diagnosed with a thyroid condition? Am I getting at something here? And so I have seen this throughout my practice for years, but I was still so surprised on everybody that commented, yep, to both. And so, I want to be clear though, I'm not saying that birth control is the only reason somebody's going to have thyroid or develop thyroid issues, but I want to talk about this a little bit because it's really important. I do believe it's a piece of a much bigger conversation that we're not having, because here's the approach that I wish was different when it comes to the thyroid, or really any diagnosis, you guys, that you get. Instead of, oh, when it comes to the thyroid, oh, your TSH is off, you're having classic hypothyroid symptoms, you have hypothyroid, here's some levothyroxine or synthroid. We'll see you in a couple months, we'll recheck your TSH, which PS isn't even looking at your thyroid function, it's looking at how your pituitary gland is functioning. And there's a feedback loop there, but we can go into that. But you will check you back in a few months and make sure everything's going, and it's all based off of your TSH, not really the person sitting in front of you. But I feel like, what if we approached it as, oh, it looks like your thyroid isn't functioning optimally. Let's figure out why your thyroid is struggling and correct it. And so that one shift of asking a little bit better question, that personally changed my life. Because when I can't remember if I was 26, 27, 28, I was still in my 20s, okay? And I was diagnosed with lovely hypothyroid. My TSH was around 6. And what was the recommendation? I'm sure you guys can guess it. Yep, go on thyroid medication. Likely for the rest of your life. Now, I'm sitting here, I'm still in my 20s, and I'm hearing this, and I remember thinking to myself, wait a second, did my thyroid just like wake up one morning and decide to quit working? Why? Like, what changed? Because here's what I've learned over the years of practicing naturopathic medicine, you guys. The body is incredibly intelligent. When something changes, there's usually a reason. And so at that point in my life, let's just put my lovely thyroid into context here. I had just finished my doctorate in naturopathic medicine while at the same time working on my master's in acupuncture. So my semester credits were getting around 24, 26. That last semester was 28 credits, you guys. That's like almost, I don't think, really humanly possible, but I figured, oh, I can do it. So I was running on stress, running on cortisol, living in survival mode. I was overweight, I was inflamed, my gut was a mess because I was so stressed. I had significant SIBO, which is small intestinal bacterial overgrowth. I had years of pharmaceutical use dating back to when I was 13 years old. A lot of this stuff that you guys have heard about me talk about over the years of being on telephone time here. And I was on years of hormonal birth control. So looking back, if we look at that, you guys, and we put it in context, do you think the problem was my thyroid? No. My poor little thyroid was waving the white flag. Help me. Like, we're creating an environment where we can't function. So instead of how do I replace thyroid hormone and just take this thyroid hormone for the rest of my life, starting in my 20s, I started asking, what does my thyroid actually need to function properly? And that led me down a completely different path. I began using the same homeopathic support and therapeutic approach that I still use today in my practice to help patients. I committed to a 90-day anti-inflammatory elimination nutrition plan. Sound familiar, you guys? I rebuilt the nutrients that my thyroid depends on, things like selenium, zinc, magnesium, B vitamins, improving protein intake because the amino acid tyrosine is also part of thyroid production, and so many people aren't getting enough protein. I worked on healing my gut, reducing inflammation, supporting my liver, lowering stress, and something amazing happened. What do you think happened, you guys? What was I doing there? What you guys hear me say all the time, over and over. I was creating the conditions for health. I was creating the conditions for my body to thrive and to heal. The weight started coming off, the inflammation decreased, my energy returned, and my TSH, the lovely lab value, went from 6 to that ideal 1.2. Most people feel best between 1 and 2 for their TSH. My thyroid panel normalized, no thyroid medication, and it stayed that way for almost a decade. And now I want to bring about an important part here that a lot of people don't talk about. So it stayed that way for almost a decade, right? Then what happened? Well, life happened. Stress happened. Illness happened. Our bodies are dynamic. Years later, I went through another stressful season. And my thyroid let me know. Some of us have a weaker organ, or some of us just don't realize how dynamic our body is, and our body will communicate. So my thyroid let me know. I developed a goiter. Yes, my thyroid became enlarged. No, I'm not in a third world country. This is way more common than people realize. People think that like goiters happen, in third world countries. No, they are happening all over in the US. Swollen, enlarged thyroids, aka a goiter, nodules, cysts are so common. I see them all the time. They're common, you guys, but they're not normal. And that's your thyroid communicating with you. So now, once again, I could have stopped there after the ultrasound and finding out my thyroid was enlarged, and my TSH did go up a little bit, but it was more just concerning that I had this gland that was quite large, and like I was wondering why my neck was looking so big. But I decided, instead of just stopping there, or watching and waiting or going on a medication, ask why. Why is this gland swollen? And that question led me to another level of learning, which is so awesome. I started to learn so much more about iodine and the important role it plays in our thyroid physiology. I learned about the thyroid's sensitivity to environmental toxins. It's the most sensitive gland in our body to toxins. I learned about chronic infections like Epstein-Barr, the latent infection of mono. Even if you don't have active mono, you can have Epstein-Barr, and it loves to attack the thyroid. So most people aren't walking around with, Hashimoto's, where people think that the thyroid is, quote, attacking their own body. It's a lot of people have Epstein-Barr chronic viral infection going on, and we have to look at immune health. And I looked at liver function. I continued supporting my body with nutrition. I removed my Carol food intolerance that a lot of you guys hear me talk about. I incorporated red and near infrared light therapy over my thyroid. And today, the swelling is gone. No more goiter. You can see right there, my neck, not so swollen. So I want you guys to know that the thyroid is sensitive. I really want people to understand this. The thyroid is one of the most metabolically active and environmentally responsive glands in the body. It's very, very sensitive. It depends on adequate nutrients. It absolutely responds to stress. It's affected by inflammation. It reflects what's happening in the gut and the liver, where a lot of conversion of our thyroid hormone takes place. It reflects what's happening with the immune system. It reflects our environment. This is why I don't believe it's enough to simply say, oh, your TSH is high, let's put you on levothyroxine or Synthroid. Are those medications, even if you're lucky enough to get an endocrinologist that maybe puts you on a thyroid medication with a little bit of T3 in there, not just T4, but that's just information. That TSH is just information. It's not the explanation. There's a reason why your thyroid gland isn't functioning. And so where does birth control come into this? So birth control is one piece of this puzzle. And why I asked about birth control this week on Facebook is because research has shown that hormonal contraceptives significantly deplete zinc, selenium, B6, B12, folate or B9, and magnesium. You guys, those are the exact cofactors that your thyroid needs to convert T4 to T3. Those are your thyroid hormones. And you have to convert T4 to T3. T3 is what is usable by the body and your cells. So like when I say levothyroxine and Synthroid, you guys, that's just T4. So if you don't have a good functioning liver, a good functioning gut, you're stressed out, you have too much cortisol, and for example, you took a bunch of birth control for years and you don't have the cofactors, you're not going to convert any of that T4 to usable T3, and you're still going to have all the symptoms of hypothyroid, but guess what? Your labs are going to look normal. And isn't that frustrating? So there's millions of women who come off birth control and their thyroid never recovers. Not because the thyroid is broken and you need to be taking like a synthetic thyroid hormone for the rest of your life. It's because the raw materials that you need for conversion were stripped from your body for years. You guys, zinc literally runs the enzyme that converts T4 to T3. T4 to T3. So if you have no zinc, you have no conversion. Your thyroid medication, if it's just T4, like literally won't work without it. Selenium, this builds glutathione, our literal master antioxidant and the liver's primary detox molecule. So without it, guess what you can't clear very well? Estrogen. So your estrogen starts to climb, your thyroid function starts to drop further. Then B6. B6 is required for progesterone production. So low B6 means low progesterone, and then your estrogen is unopposed, which you do not want going on in your body. Then B12 and folate, they drive your methylation process. This is how your body processes hormones, neurotransmitters, and toxins. If that starts to stall, everything downstream backs up. Then you have magnesium. This is just a whopper. Magnesium is involved in literally over 300 enzyme reactions in your body, including thyroid hormone activation. Okay, so you guys, you got a little biochemistry, a little info there, but can you see how over years these deficits compound? You come off the pill and your thyroid can't convert. Your liver can't clear estrogen. Your progesterone has no raw materials. And so what do women get? They get some Synthroid, some levothyroxine sent on their way, and then, and this is probably in their 30s, then you start to get closer to 40. What are you hitting? Oh, now you're getting closer to perimenopause. Oh, now you need hormone replacement therapy. Let's just sprinkle some hormone replacement therapy in there with your levothyroxine and your Synthroid and send you on your way. Sprinkle that on the top and you'll be good to go. And why do so many women still struggle with their weight and all of the symptoms, and I still don't feel like myself? It can get really, really, I get frustrated because nobody's asking better questions. Nobody's connecting the pill at 18 to the thyroid diagnosis at 33, and then the horrible perimenopause symptoms as you reach 40. So we have to rebuild the cofactors. We have to support the systems involved. When that conversion comes back online, your body can actually start to heal. So now, am I saying birth control is the only reason every woman develops a thyroid problem? No, of course not. But it could be one main factor that contributes to the bigger picture for some women. And so we need to have that conversation. We need to support that. But I do want to address, because one gentleman commented on my post, he's like, hey, what about the men who have hypothyroid? I didn't take birth control, even though some men are taking testosterone and they're not realizing that's the male birth control. But this absolutely applies to men as well, because so he had asked, I have hypothyroid, but I never took birth control. What about me? And that's a great question, because this brings up the bigger issue of not just birth control, but nutrient depletion. We have ultra processed foods, inflammation, stress, poor sleep, gut dysfunction, environmental toxins, pesticides, liver congestion, and that affects all of us, men and women. And so I'm sharing this with you guys. I don't want you to get overwhelmed, because it can feel a little overwhelming. But I want you to understand that our bodies are absolutely amazing, and they actually start to respond very fast when we just start doing some of the right things to creating the conditions for health. You don't have to be perfect, but you have to start making those right decisions and get someone in your corner to help you do that if you're still not feeling well, and if you just keep getting medications piled on. I did want to point out one thing about iodine, because a lot of people don't know this. Another piece that I really feel deserves much, much attention is iodine. So many people think, like I had mentioned with my lovely goiter, that iodine deficiency disappeared decades ago. It's only in third world countries, but mild to moderate or even severe iodine insufficiency, like in my experience, still exists in the United States, especially, you guys, for those of you who are local, around our Great Lakes area. It's actually where we live has historically been known as the goiter belt. So many people don't know that. And then we also have widespread exposure to halogens, things like bromide, chloride, fluoride, Look up what those are in. Those just rampant in our environment, and processed food and pops and clothes and furniture, and they put chlorine in our water. I mean, you guys, it's wild. Thankfully, people are recognizing not having fluoride in their water, but bromide, chloride, and fluoride are halides that literally compete with iodine because of their similar chemical properties. And so not only are most people walking around deficient in iodine, the iodine they have can't get to their cells because of all these bromides, chlorides, and fluorides that we're being exposed to. And guess what gland uses the almost the most iodine? The thyroid. So do the ovaries. So many women struggling with infertility don't even realize that they need iodine. And so, but that's a topic for another day. And I want you guys to understand that this is about the terrain that the thyroid is living in. But it's really important to get someone in your corner who can help, because you don't want to just go start taking massive doses of zinc, because zinc can throw off copper. So the solution is just like, oh my God, I'm going to go take a bunch of zinc and I'm going to be cured. No, you can't. You gotta, the body is dynamic. So yes, maybe a little bit, but you don't want to overdo it. Same with iodine. You're like, oh, I'm struggling with this. Let me just go take a bunch of iodine. You definitely don't want to start doing that. You can start massively detoxing all the bromide, chlorides, and fluorides. So there's a method to the madness. We can support our body, but we have to do it in an intelligent way. So if there's one thing I hope you remember today, you guys, it's this. Your thyroid isn't isolated. It's part of a beautiful connected system. Sometimes medication is an important tool and may be necessary for some people, but I never want us to stop asking the deeper questions. Why is the thyroid struggling in the first place? That's what gets me excited, because when we can actually find the solution, we can identify the nutrient deficiencies, we can reduce the inflammation, we can support the gut, we can care for the liver, we can address the stress, we can improve our sleep, we can literally, here it comes, you guys, create the conditions for health, because then the body has this innate, incredible ability to move toward healing. And that's why I love the total health restoration, because I've helped so many women literally heal their thyroids. You know, I never like to, I always like to under promise and over deliver. Some people are like, will I be able to get off my medication, this or that? You have to talk about that with your primary care and work that through. But usually, as we start creating the conditions for health and the body starts to heal, that is something that can take place, and you work with your primary care, and most doctors who are in your corner are excited to see you get off medication and have your body function on your own. And that's the heart of naturopathic medicine, you guys. Not chasing symptoms to match medications for life. It's understanding the physiology, understanding the person sitting in front of you, and asking better questions. Don't you agree, Jam?
Oh, totally. As I just mentioned with everybody yesterday, sure, we are in America, one of the greatest countries in the world. I am malnourished.
So many of us are.
And so, you know what you're saying? This is so topical, especially for
Yeah.
a guy like
Yeah.
me. So, thank you for bringing this to everybody's attention,
Yeah.
Dr. Linzi.
Absolutely.
People have more questions. They've got concerns. They want to know about false positives. How can they get in touch with you?
Absolutely. They can email info@drlinzi.com. That's info at drlinzi.com. You can also call or text 906-829-0500. And I feel like the best way is to connect on social media. Linzi Say Larson, and that's Linzi, and then Say, S as in Sam, AIGH, and then Larson, LARSEN. And you can message me on Facebook. We can connect on there. I'm always sharing things. And
I just want to mention, if you are one of our followers on the X Files at